Let me tell you about one of my recent cases where we almost missed a deadly diagnosis. A 55-year-old man developed chest pain while walking on the street, and so he came to the ER. He was triaged right away, his vital signs were stable, and ECG was done immediately, and it was normal. And so he was sent to the main waiting room where blood work was drawn. I saw him about 50 minutes later, and while I was assessing him, he kept telling me that the pain kind of felt like gastric reflux, but a bit different. And he kept rubbing his chest and stretching it, trying to make it go away. And that really worried me. So I ordered a repeat ECG while I was still in the room, and that told a very different story. This is the ECG, and it showed dynamic ST elevations in the inferior leads consistent with an acute heart attack. I didn't have any of his blood work back, but I called the interventional cardiologist who was already in the cath lab, and she told me to send him up immediately after giving aspirin and ticagrelor. When I told the patient and his partner that he was having a heart attack and he needed to go to the cath lab, he didn't believe me. He actually said, "You're joking, right?" And he asked, "What day would I be booked in for?" And I said, "No, you're going right now." We rushed him upstairs and found a complete blockage of his left anterior descending artery, which the cardiology team opened up with a stent. His initial troponin, a marker of heart damage drawn at triage, came back completely normal, but when it was repeated the next day, it was sky high, reflecting the massive heart attack. He was discharged home in stable condition 2 days later. The lesson here is this. Early ECGs and blood tests can be normal, even in life-threatening heart attacks. These tests are just snapshots in time, and the findings can evolve as the disease progresses. Sometimes the difference between catching and missing a diagnosis comes down to listening to the patient, trusting your instincts, and repeating a test if something doesn't feel right.